In CBT, the therapist starts by identifying the irrational thoughts the client has. For example, the client may believe they're a failure. The therapist attempts to help the client identify the impact of this thinking on their feeling and behaviour. For example, they may feel depressed or anxious and avoid putting themselves in situations where they might fail again. In Ellis's REBT, the therapist will ask the client to identify an activating event and the resulting irrational belief in order to improve the emotions and consequences or behaviour of the individual. For example, a client who identifies a failed job interview and the resulting thoughts that they're useless and unemployable will feel and behave more positively if they can believe the failed interview was not a reflection of their self-worth, but an opportunity to refine their interview skills for success in the future. During CBT, the therapist might ask the client for evidence that supports their irrational beliefs about themselves and the world around them. This is part of the process of trying to change the maladaptive thoughts. The therapist challenges the belief of the client in order to get the client to see that what they believe about themselves and the world around them is not true and not helpful. In Ellis's REBT, this can be quite confrontational. The client's beliefs are directly disputed in a number of ways. For example, the therapist might ask the client if it makes sense to assume that they're undesirable to everyone based on the opinion of one boyfriend or girlfriend who's chosen to end their relationship. The realisation that their thinking is wrong is required before the irrational thoughts can be replaced with rational ones. The therapy has two elements, the cognitive and the behavioural. The behavioural element is focused on the client developing a range of coping strategies. In between therapy sessions, a client might be asked to try out a problem-solving technique discussed with the therapist. For example, a breathing technique to cope with anxiety or a mantra to repeat to boost confidence in a new situation. These can be practiced and applied. The coping strategy can then be evaluated with the therapist. Clients might be asked to keep a diary in order to identify negative or irrational thoughts or to gather evidence to challenge a client's belief that negative outcomes happen to them more than anyone else. A strength of CBT is that it's been shown to be effective. For example, Engels et al. Carried out a meta-analysis and concluded that Ellis's REBT works for a range of disorders, including OCD, and that it was more effective than some other psychological therapies for anxiety disorders. CBT can not only be used for mental health disorders, but also for general self-improvement. Despite the success of CBT, however, the therapy has been criticised as clients require a high degree of motivation and commitment to fully benefit from this therapy. For example, a client that does not complete homework tasks such as completing a diary or who's unwilling to change their thinking is unlikely to find CBT useful. CBT could be argued to be unethical, as a therapist has to dispute the client's beliefs. These beliefs might be based in a religious belief system, and the confrontation involved in Ellis's therapy could actually be inappropriate.